It has now been 10 days and 60 dead British Columbians since the government of that province has asked the Prime Minister to reverse his deadly and radical legalization of crack, heroin, and other hard drugs in children's parks, hospitals, on transit. Why will he not reverse his radical agenda?
Communities in BC are facing an extremely serious challenge. It is a toxic drug supply on the streets and people are dying. We know that public consumption is an issue of concern, which is exactly why, Mr. Speaker, BC is amending their proposal, and we have been working with them every step of the way. We're treating this with the urgency it deserves, and all partners are at the table right now, Mr. Speaker, to find the path forward, working with law enforcement and health services so that we get this right and save lives, Mr. Speaker.
Mr. Speaker, to find a path forward, the path forward is obvious. Ban hard drugs, invest in treatment, bring our loved ones home drug-free. Now, that minister claimed last week that she was waiting for the BC government to provide information before she could decide on reversing radical legalization. It turns out the government had given her that information within hours of the request. She has all the information, so why are her and her radical boss clinging on to this insane policy?
On this side of the House, we follow science, we follow healthcare experts, and we follow the information. We are working with BC on a comprehensive amendment to their proposal. This takes collaborative work, Mr. Speaker, to get it right. This is a health issue, Mr. Speaker, not a criminal one. The Leader of the Opposition is misleading Canadians in not recognizing that people need health care. They do not need to be re-stigmatized and criminalized.
The Abbotsford Soccer Association wrote a letter entitled "A Cry for Change." Volunteers with the organization have found dirty needles that can puncture innocent children in the playing field. Other BC fields have had women raped and overdose, have found addicts naked, have had pets actually overdose because there's so much drug contamination on the site. What are they thinking over there?
Mr. Speaker, a pilot project was put in place at BC's request. BC now has serious concerns about some aspects of that. We share those concerns and we are addressing them. But I do want to say, Mr. Speaker, I do not think there is a family in Canada that is untouched by the tragedy of opioids. And I think that it is absolutely abhorrent to try to score political points off the pain of Canadians.